If, for example, you were to get the neuromuscular abdominal exam patient scenario, it looks exactly like this. So what we want to do is kind of look at what's going on with the patient. So the patient presents to the clinic reporting a 4-week history of numbness and tingling of the fingers. Other associated symptoms that began around the same time include fatigue, vision changes, and constipation. The symptoms are becoming progressively more noticeable, which is why the patient has decided to come in for an evaluation. The patient has been doing some research on the internet and is concerned that she may have multiple sclerosis. Okay, so if we look at the elements for evaluation, K-wipes is worth 3.5 points. The abdominal or GI system assessment is 3.5 points. The neuromuscular is 13 points, and our documentation is worth 5 for a total of 25 points. So 1 point is professionalism, which means we want you in your clinical attire, have all of your stuff ready. We want to make sure we're maintaining eye contact with the patient when we're doing our reporting, and that we're not saying inappropriate words, and that we're acting professionally the entire time. So if you look here, it breaks it down for you what each thing is worth. So with our K-wipes, I'm going to knock, I'm going to wash my hands, I'm going to introduce myself to the patient. Hi, I am Veronica, I'm going to be your nurse today. And then we're just basically going down the list, providing privacy. So obviously we don't have privacy here, so I just want to say I'm going to provide some privacy. Is it okay if I shut the door? Whatever it is, identify that you're providing privacy. Explaining our procedure. So today I'm going to be doing an assessment on you, if that's okay. And you just let me know if you have any questions during the process, okay? And then last but not least, I want to make sure that the patient is safe. So if I don't know, this particular patient scenario, you're obviously at home or in the lab with your patient, so they should be safe. But if for some reason in real life your patient is like half laying out of the bed, or there's their oxygen thing is wrapped around their neck or something like that, we want to take care of that right away. But part of that is just doing a safety scan of the room. I see that everything is fine. I maybe have some shoes that I'm going to just tuck under the bed here so that those are safe. The bed is in the lowest position, which I don't think it is, but this is a weird bed. But regardless, I'm just going to kind of verbalize that stuff out loud. Now, if you see here, it says half a point value for each late catch. So let's say I walk into the room, hi, I'm going to be doing this for you today, and I start to do my assessment, and I'm like, oh my gosh, I didn't provide privacy, or I didn't knock on the door, or I didn't wash my hands. If I go back and do those things, you certainly want to do that, but you're just going to get half points. Because this is recorded, you could just say, stop, let's start over and do it again. So you guys could do that if you want to. I also want to identify my patient, and so I do not have a chart with me, but I might just pretend that I have a chart when I go into the room. So I do my knock, wash my hands, provide privacy. Hi, I'm going to be your nurse today. My name is Veronica. How are you doing? Is it okay if I just check your name band with what I have here on your chart? Thank you. And so I look, and it says I have blessing. And can you verify your date of birth for me, blessing?
March 13th.
That's exactly what I have. Thank you. Put that aside. And then I explain that I'm going to be doing an assessment for you today, if that's okay. Just doing a quick safety scan of the room. I don't see anything that's, cords that are out of the way. She looks like she's in a nice neutral position. I'm okay to start my assessment. So if you just saw what I did, that took like 1 minute. So I have 1 minute down, and I earned how many points? 3.5 already? Perfect. So next thing you want to do, if I kind of just go right down the list here, is I want to do my subjective history. So she had a bunch of complaints. Your question? You're stretching? Yeah. We go back to her complaint list. It said she had numbness and tingling of the fingers. She had fatigue, vision changes, blurred vision, and constipation. And they've been getting worse. So when I go down here, it says I can do them kind of all wrapped up into one. I don't have to add old cards for each individual one. But it gives me a prompt here of stuff that I could ask. So if I am practicing, I want to kind of just look at my sheet when I'm practicing, get these things ingrained in my mind. But it's prompting me to ask her, have you noticed any changes in your mental status? Like, Is it hard for you to recognize, what date it is or who the president is or anything like that?
No.
No? Okay. And I might ask her, where are you right now? Okay, and do you know what day it is today?
It's
Who knows, right? So if you had a patient, right, if you had a patient where they, were in the hospital for quite a while and they really, I don't even know what day it is today, I could say, what season of the year is it?
winter.
Well, it's getting to be winter, right? Exactly. So then just going right down the list, have you had a headache recently? You had a headache one day?
Yeah.
Okay. Any vision changes?
Yes.
Yes. Can you tell me about those?
I have a blurry vision.
Blurry vision.
Makes my movement unsteady.
Okay, blurry vision makes your movement unsteady. When did that start?
3 months ago.
Okay, and so location-wise, if I'm doing my old cards, it's obviously in her vision. And duration, how does that, is it come and go, or does it seem consistent that it's always like that?
Comes and goes.
Comes and goes. Is it getting worse?
Yes.
Yes, okay. Is there anything that makes it better?
My glasses sometimes.
Your glasses? Anything that you found that makes it worse?
The weather or nighttime.
Okay, and then on a scale of 0 to 10, 0 being it doesn't affect you at all, 10 being it's really affecting your life, how would you rate that on a scale?
7.
7, okay. So now I did my old cards symptom analysis on one of her symptoms. But I still want to ask her the other changes. Any muscle weakness,
Yes.
changes in movement, balance, or coordination? Yeah. Any back pain or extremity pain?
Yes.
Yes. Okay, any numbness or tingling?
Yeah, I'm not honest.
And loss of bowel or bladder function? Yep. So she said yes to a bunch of those. In a real world scenario, I'm going to ask her the old cards on all of those, but because we only need to do one, just to keep things going, I only did my old cards on one of her problems. Okay. And so then we go on to assessing her mental status and level of consciousness. So I kind of started asking her some of those questions as we were going along, but I can ask her more questions like, what's your name?
Lesson.
And the day today, which we all had no idea. I can ask her if she knows where she is, and she does. And what brought you here today?
The numbness and tingling.
Okay, so it sounds like she's a, A&O times 4, so that's good. I'm going to evaluate her speech. So it sounds like she's able to speak with me without slurred speech or anything like that. She's able to use appropriate wording. So I'm just verbalizing that stuff out loud. And so again, look at, just made myself 1 point. I got myself a half a point for that. And now I'm going to observe your facial symmetry and assess facial nerves by having the patient smile, frown, puff out cheeks, raise eyebrows, and close eyes tightly. Okay, so Blessing, I'm going to have you copy my facial expressions, okay? So can you smile? Can you frown? Can you puff out your cheeks? And then can you raise your eyebrows? And then close your eyes real tight. Okay, perfect. Looks like everything is intact. She's able to do that appropriately. So again, if we look at that, I'm able to get half a point right there. All right, so next one is cranial nerve 3 worth 1 point. So hopefully I have my pen light with me. All right, I'm just going to shine a light in your eyes. I want you to look straight ahead at my nose, okay? So I'm gonna shine it in her eyes. And I'm gonna do the same on this side. And then I can see that her pupils are equal, round, and reactive to light, and they're about 3 millimeters. And so then I want to assess cranial nerve 2 with confrontation. So again, I'm going to have you stare at my nose, or actually stare at this pen. And I'm going to bring it closer to you, and then further away. And I watch her pupils dilate and constrict, and that's appropriate. And then I'm going to assess cranial 3, 4, and 6 for cardinal positions of gaze. So again, I'm going to have you follow my pen, just with just your eyes. Don't move your face, okay? It looks like all of those movements are intact, so cranial nerve 3, 4, and 6 are intact. Next, I want to have her shrug her shoulders against resistance, and then turn her head against resistance. So I might have to have you sit up at the edge of the bed, if that's okay. Just have your legs swing that way.
Oh, okay.
All right, so I am going to put my hands on your shoulders and I want you to shrug.
Like this.
Yep, and I'm putting a little bit of resistance on there. It looks like she's able to do that. Now I'm going to put my hand right here and turn towards my hand. Turn towards my hand, and I gave her a little bit of resistance, so that looks like it's good to go. So now imagine that you guys are running through this scenario with your person that you're practicing with, and you've done it 3 times. By the time that you get to doing it and recording it, you should have it down pretty well. So I'm going to assess limb ataxia, have upper limbs touch examiner's finger to patient's nose and finger while examiner holding finger. Okay. Here's the next one. Is I'm going to have you touch your nose and then touch my finger, and my finger is going to move. Okay. So take your hand and touch your nose, touch my finger, touch your nose, touch my finger, touch your nose, touch my finger. Let's try it with this hand. Touch your nose, touch my finger, touch your nose, touch my finger. All right, and on this one, I want you to take this heel and run it up and down this shin, okay? And same with the other one. Both sides. Very good. Okay, and so then I want to, so I've got a point for that one. The next one is assess motion and sensation. Ask patient which finger or toe I am touching, and have patient wiggle fingers and toes. Okay. So I'm going to have you close your eyes. I'm just going to take your hands here. Close your eyes, and I'm going to pinch a finger, and I want you to tell me which finger I'm pinching.
This one.
So is it the left or right hand?
Left.
Left, which finger?
1, 2, 2.
Pointer finger. Okay. And I'm going to do the same down here. I'm going to pinch your toe. Tell me which toe I'm pinching.
The left last one.
Little one, yeah? Okay, how about over here?
Okay. The second one on the right.
Yeah. And how about over here?
The pinky on the right.
Okay, can you wiggle your toes for me? And then wiggle your fingers? Perfect. So that would give me a point there. And now I want to look at upper and lower extremity strength. So I'm going to put my hands under your feet. Why don't you push on me like a gas pedal? Real hard, real hard. Perfect. And then pull up towards you. Good. And then now with your arms, I want you to give me a good squeeze. Squeeze, squeeze, squeeze. Now push me away from you. And pull me back towards you. And I'm giving her some resistance, and she's able to do that. All right, so now we want to assess her range of motion from head to toe. So with neck, I want to see if she can copy my movements, okay? So I want you to do the same thing that I'm doing, okay? So bend your head like this, and back like this, and then over like this, and that way. And then can you go side to side? Perfect. And I'm going to do the same with her, each of these areas going down. So with thorax, with flexion and extension, I want to have her do lateral bending and rotation, right? And shoulders and elbows and wrists, like this and like this, up and down, back and forward, like this. Obviously, if she's a patient that's pretty unstable, I don't want her to do a lot of these things with hips and knees and things like that if she can't stand. But if she can, with knees, I want you to bend your knee and then flex it out. Perfect. Ankles and feet, dorsiflex and plantar flexion and inversion. So in and out. It's kind of hard to do in and out. And then can you rotate around and do that with both sides? So we want her to do it bilaterally. With hips, like this. Can she go cross them like this? We don't want to do crossing if somebody has had a hip replacement. Can she go out and then up and back? So we'll have her do all those things if she's able to. Your patient hopefully will be well at home, and you can have them do all those things, standing up on the couch or whatever. Assessing for balance with Romberg's test. So again, I'm going to have you stand. Make sure you're not dizzy or lightheaded. No. Okay, I'm just going to have you stand still and close your eyes. And just make sure she's not swaying back and forth. And then I'll have you put both arms out like this, with palms up. And again, close your eyes. Everything looks good. Now, if she had pronate or drift, she'd start to rotate her hands. Okay, everything looks great. You can go ahead and have a seat. gait and symmetry, I might have her walk to the end of the room and back. Again, if you guys are confined into like a living room space or whatever, just have her take a couple steps this way, turn around, take a couple steps like that. And then I want to calculate her Glasgow Coma scale, so I'm going to do that. She can obviously follow commands if I have her open her eyes for me. She's can open her eyes without commands. She can verbally talk to me. I don't have to like stimulate her with pain, and she can do stuff like that. So her Glasgow Coma scale will work really well. Now we're going to do her abdominal examination. So I'm going to ask you a few questions. Are you experiencing any abdominal pain?
Yes, from the constipation.
From the constipation, okay. Any loss of appetite? Nausea or vomiting?
No.
Are you passing gas?
No.
When was your last bowel movement?
1 week ago.
Do you remember what it looked like?
It was really hard.
Really hard, okay. So in the perfect world, I want to do old carts on all of that stuff, but I only had to do it on the one, which I did. Okay, so now I'm going to do an abdominal examination. I need, so if I can have you lay down without falling. All right, so first thing I want to do is inspect, and so I'm going to, peel back just so I can see skin. Now, if your patient at home is not comfortable with you looking at their stomach, you can just verbalize, I'm looking directly at the patient's skin. I don't see any lumps or bumps or bruises. Everything looks nice and smooth with contour. The skin is appropriate color for the patient's ethnicity. And so now what I want to do is have you just flex your knees, just like that. And I'm going to take a listen. That's all right. So when I listen, I want to listen, maybe start in the left lower right quadrant, just as a good landmark. And I'm going to listen, and listen again on the skin. And then I want to do some light palpation. So I'm going to press lightly on your stomach. You tell me if you're feeling any pain or discomfort, okay? Any pain right here? Any pain right here? No? Okay. So does it hurt when I push down, or does it hurt when I let up?
When you push down.
Okay. And then how about over here?
No.
Okay. So I would note that in the left upper quadrant, patient had some pain, and then again, old cards would tell me, on a scale of 1 to 10, what it felt like, that kind of thing. But I don't need to do that because I've already done my system analysis on one.
So are we supposed to, like, keep as a human for constipation?
Mm-hmm.
So should you?
In a real world, yes, but you are only required in this test out to do old cards on one of their problems. And so we did that kind of in the beginning. We got that out of the way.
Then I have a question. Like, with all these problems that I have, if we get to that point where you ask a question, am I supposed to say yes to them? For instance,
You can say yes to the problems that you have. And I, in a real world, would ask old cards on all of those, but because we're doing a test out, I only have to do it on the one item, and so I already did it on the one item right away. When did those problems start for you? And you told me like 3 months ago. So I already kind of encompassed that, so I don't have to do that. But in real life, if someone had a problem and they said yes to something, you might want to look at that.